Just 2 months after closing them, UAMS's dedicated COVID units are reopening. TV11's Ian Russell spoke with the CEO, who says this is a step backwards in the pandemic and one they hope they wouldn't have to see again.
UAMS leaders and nurses were hopeful at the beginning of summer, but now not so much. Just 2 months later, COVID units here at UAMS will begin to reopen to deal with a rise in new COVID cases.
It is pretty hard to understand why we are still in this place at this point.
For UAMS CEO Dr. Stepi Meza, the beginning of the summer was a breath of fresh air.
We thought at this point during the summer months that we would be seeing such a low level of COVID that people could relax, and you're seeing the opposite.
But things have changed. COVID cases continue to skyrocket across the natural state. At UAMS, the spike they're seeing is so big, they've had to reopen 3 dedicated units for treating COVID patients that were shut down at the beginning of the summer.
And now we have reestablished each one of the previous COVID units that we had.
This video is from last week when the units weren't as full. We weren't able to film inside Thursday because those units are so full and because of that, so dangerous.
And now we have established yet another critical care unit, or ICU, intensive care unit. That's new from what we did last spring.
What's not new from last spring is the number of people admitted who aren't vaccinated. Last spring, no one was vaccinated, and there's not a big difference in the numbers a year on.
85 to 90% of those patients admitted with COVID to UAMS have not been vaccinated or are not fully vaccinated.
It's a cycle that they hoped we'd break by now, leaving those working face-to-face with these patients more exhausted than ever, and leaving those discharged upset they ever had to go.
I think regret really is a pretty common theme amongst the patients that have not been vaccinated.
Meza says there's a lot of emotions they're feeling right now. Frustration, disbelief, anger, but also pride. This is a situation they've been in before and one they know will eventually come to an end.
We don't see the light yet. We know it's there. We've been through this already, and we're confident that we'll get through it. We just don't know when that it's going to be.
Reporting in Little Rock, I'm Ian Russell, THV 11 News.